If you are experiencing panic attacks, you may have a condition called panic disorder, and if you have, it's important to get it treated as soon as possible. In this video, I'm going to ask you a number of questions. The questions are based on the criteria for panic disorder in the Diagnostic Statistical Manual of Mental Disorders, which is used by mental health practitioners to diagnose mental health problems like panic disorder. Of course, it's better to get a formal diagnosis from a doctor or mental health practitioner, but this test will give you a good indicator. So let's get started. Firstly, you need to understand what a panic attack is. DSM-5 defines a panic attack as an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes and during which time 4 or more of the following symptoms occur: palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, feelings of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills or heat sensation, numbness or tingling sensations, derealization, which is a feeling of unreality, or depersonalization, which is a feeling of being detached from oneself, fear of losing control or going crazy, and fear of dying. So now that you understand what a panic attack is, answer the following questions with yes or no. Question 1. I experience recurrent unexpected panic attacks. Question 2. I constantly worry about having a panic attack and its consequences. For example, losing control, having a heart attack, going crazy. Answer yes or no. Question 3. I have adapted my behaviour to try to prevent panic attacks. For example, avoiding certain places or situations which I think might provoke an attack. Question 4. The disturbances that you experience are not attributable to the physiological effects of a substance, for example, from drug abuse or a medication, or another medical condition, such as hypothyroidism or cardiopulmonary disorders. If it is not attributable to one of these explanations, then answer yes. Question 5. The disturbance that you're experiencing is not better explained by another mental disorder, for example, social anxiety disorder, or a specific phobia, or in response to obsessions related to OCD, or in response to reminders of traumatic events, such as in post-traumatic stress disorder, or in response to separation from attachment figures, as in separation anxiety disorder. If it is not attributable to one of these other disorders, then answer yes. If you answered yes to 4 or 5 of these questions, you will likely meet the criteria for panic disorder. Panic disorder is a very debilitating anxiety disorder, and if not treated can get worse, and even develop into agoraphobia, which can leave you housebound. If you can't afford or access therapy, fear not. Take a look at my panic disorder playlist, which is an invaluable resource on CBT techniques. However, the real gem lies in my 8-part video series, a comprehensive guide designed to equip you with everything necessary to minimize or even stop panic attacks. Although conquering panic attacks isn't easy, viewer feedback has been very positive. So join the ranks of those who have persevered and conquered panic attacks with this effective and easy to follow series. And I even have hypnosis videos specifically for panic disorder, which reinforce what you learn in the CBT series and make the recovery process easier. I have tried to provide you with everything you need to stop panic attacks, so please subscribe and like my video. Take care now.